Hey folks, today we're going to talk about how adjustments affect our special forces. Pretty interesting stuff. We're going to talk about cervical disc herniations and whether adjustments can help those. And we're going to talk about lazy Americans. It's a fascinating one today, so y'all don't go anywhere. But first, here's that silky smooth bumper music. All right, we're back, so let's get on with it. Welcome to the podcast today. I'm Dr. Jeff Williams. I'm your host for the Chiropractic Forward podcast. So glad you joined me. You've collapsed straight into episode number 74. Bing, bang, boom, knocking them down one after another. We're doing more and more guest spots here lately and have several guests set up to come on the show. Some you know, some you don't, but you're going to love them all. Some are known names, like I said, but they're all interesting, and all of them bring something unique to the table that we're able to learn and grow from. And that's the whole point, isn't it? Keep coming back time and time again. You'll see what I mean. What I'm here for, I believe, is to advocate for chiropractic, specifically evidence-based, evidence-informed chiropractic, while we also make your life a little bit easier using research and some good solid common sense and smart talk. Who the hell doesn't like some smart talk and common sense, huh? Let's talk about a little bit about the F4CP. Just to let you all know, the F4CP, Foundation for Chiropractic Progress, will be launching an Athletes and Opioids ebook towards the end of this month. It's called A Case for Chiropractic, Disrupting the Cycle of Pain, Prescriptions, and Addiction. I've got a link to it in the show notes. Make sure you go check it out from the F4CP ebook. Pretty good stuff. DACO, the DACO program, we talk a little bit about that every week. We've been in the habit of discussing it weekly because I was going through it, right? Well, I'm done with all the hours, all 300 of them. Whew, all 300. It feels good to say that I am done with all 300. I'm not going to lie. So now what? Am I supposed to tell you about how I'm studying? That doesn't sound very fascinating to me, really, at all. In fact, that may be a cause for blood to be leaking out of your ear holes. And nobody, most importantly, me, nobody wants that.
I don't think so.
See, I didn't think so either. So today, I'm just going to talk real briefly about one of the courses I reviewed yesterday and going back over the material. And it's one I didn't pick up on very strongly the first time, I guess, because I spent the entire study session on just this course. Usually I knock out 2 or 3. Well, just got through this one because it was difficult. And it had to do with disc herniations that were more up in the T11, 12, or L1-2 area, and how they can mimic other issues further down the line. It's really interesting stuff, but it went into how a hyperreflex on a patellar reflex, a numbness in the anterior part of the thigh or calf without associated pain, should move our thinking to an upper motor neuron lesion, which would mean it's higher up. Right? Remember, the spinal cord ends at L1-2, correct? You need to know this stuff because that sort of issue may mean immediate surgical consult. It's interesting stuff. I got it a little better the second time around. I'm better today than I was yesterday. But also in the Chiropractic Forward group, I posted a graphic from Yokuhashi et al. Demonstrating common signs and symptoms of thoracolumbar junction disc herniations. Also added a great Epley maneuver that is easy to perform, as well as an easy classification flow chart that I just added for reviewing MRIs and classifying herniations. If you're not a member of our Chiropractic Forward private group on Facebook, you need to go over there and request me to add you. Assuming you're not crazy and curing cancer through your adjustments, all right? So, assuming those things, then I'm happy to add you to our group. Now, if you hear something here that you really like and you'd like it in a written form rather than spoken, just hop onto the chiropractic4.com website, find the episode, scroll down, and you can just copy and paste it. But if you're using it for content on your website for some reason, just be cool. Give us some credit. Doesn't take much to do that. I'd sure appreciate it. And I'm sure the researchers that we cite on our show, I'm sure that they would appreciate it too. It takes a lot of hard work to bring us such high-level information. Now, item number 1 this week. Let's get it rocking and rolling here with a paper that one of my very favorites, is a co-author on. The lead author on it is James DeVocht, and then Robert Vining, Dean Smith, Cynthia Long, Thomas Jones, and a previous guest with us here, yes, one of our favorites, Dr. Christine Gertz, the superwoman of chiropractic research right there. And she's also going to be a presenter at Chirotexpo in downtown Dallas, Texas, June 7th through 9th, I believe, June 7th through 9th. I'll be there, front row, with a smile. And, maybe a drink. It just depends on how early her talk is. Is it going to be a mimosa? Or, I don't know. I'm just teasing. Anyway, as far as you know. Anyways, this one is called Effective Chiropractic Manipulative Therapy on Reaction Time in Special Operations Forces Military Personnel, a randomized controlled trial. This was in the BMC and published this year. Here's why they did it. Considering that chiropractic manipulative therapy has been reported to improve reaction time in some studies, and considering that reaction time can be vital for Special Forces military men and women, these authors were interested in if chiropractic treatment could be effective in improving reaction time for this type of patient. That's a great question. Here's how they did it. 120 special ops personnel were accepted into the study. It was prospective randomized controlled trial, so 60 in one group, 60 in the other. It was conducted at Blanchfield Army Community Hospital, Fort Campbell, Kentucky. One group received 4 treatments, while the other received none over a 2-week trial period. Assessments used were hand-foot reaction time, choice reaction time, Fitts Law. I don't know what Fitts Law is, but sounds like something I need to check out. And whole body response time. And here's what they found. No between-group statistically significant differences were found for any of the 5 biomechanical tests except immediate pre- and post changes in favor of the chiropractic manipulative therapy group in whole body response time at both assessment visits. So wrapping that up, the author's conclusion was this, quote, a single session of chiropractic manipulative therapy was shown to have an immediate effect of reducing the time required for asymptomatic Special Forces qualified personnel to complete a complex whole-body motor response task. However, sustained reduction in reaction or response time from 5 tests compared with a waitlist control group was not observed following 3 sessions of chiropractic manipulative therapy. End quote. Okay. What's the takeaway here, and where does that lead research in the future? Well, here's a question from me that I would ask them. Here's my question. We know chiropractic has immediate but somewhat unsustained effectiveness now that we did this paper. So, okay, immediate but unsustained effectiveness. So what if they are regularly adjusted, as in like 3 to 5 times a week? For 4 weeks when compared to other non-treatment group? Is it sustained any longer at that point? And if we know they're going on a mission and they're treated once a day or even twice a day, does that have more impact, more long-lasting effect? And what about athletes and their reaction times, right? There's good stuff here. I mean, I think there are a lot of interesting questions just waiting for a good, solid answer. I mean, imagine the professional sports teams that would be interested in this sort of research. I mean, I think it's fascinating. And I mean, not to mention Special Forces. I mean, good Lord, their life is on the line, so they're interested. So I can't wait to see where all of that research goes. So many good questions. Now, item number 2. Moving on. Let's move on to cervical manipulation and cervical discs. There are 2 papers here, so we're going to shorten it up and just hit the highlights. I'm not going to tell you how it all went and all that good stuff, outcomes, none of that crap. Just the meat and taters, please, waiter. Thank you.
This is ridiculous.
The first one is called, the title is so damn long, honestly. I'm not even going to go through the whole thing. We're just going to call it cervical disc herniation and a comparison between adjustments and nerve root injections. If they want people to repeat the whole damn title, well, then they need to make them just a touch shorter. Thank you. Thank you, please. You can look the full title up in the show notes in the episode. It was published in the Journal of Manipulative and Physiological Therapeutics in 2016, authored by Cynthia Peterson et al. And the reason they did it, they wanted to assess the outcomes for improvement, pain, and costs between nerve root injections and spinal manipulative therapy. So basically, chiropractic versus nerve root injections for neck pain, which is another great question, by the way. Here's how they did it. 104 patients with MRI-confirmed symptomatic cervical disc herniations, 52 had nerve root injections, 52 had chiropractic treatment. Manipulative therapy, sorry. Chiropractic is really much more than simply manipulative therapy, but I digress. The conclusion on this paper, get this, the improvement for manipulation versus injection, manipulation in the subacute chronic population showed 86.5% improvement, while injections had 49.
Yay!
That's what I'm saying, man. Doesn't that feel good? It always feels good when you see this stuff. And this is, to be fair, it's a little older paper, but it's awesome. Manipulation in the subacute chronic population showed 86.5% improvement, while injections had 49% improvement. Booyah. Next paper on this same topic is from the same author, Cynthia Peterson et al. Is called Outcomes from Magnetic Resonance Imaging Confirmed Symptomatic Cervical Disc Herniation Patients Treated with High-Velocity, Low-Amplitude Spinal Manipulative Therapy, a prospective cohort study with 3-month follow-up, published October 2013 in the Journal of Manipulative and Physiological Therapeutics, and it goes something like this. The purpose of the study was to investigate outcomes of patients with cervical radiculopathy from cervical disc herniation who were treated with spinal manipulative therapy. So what they found was most patients in this study, including subacute chronic patients with symptomatic MRI-confirmed cervical disc herniations treated with spinal manipulative therapy, reported significant improvement with no adverse events. Well, there you go. And it's better than cervical nerve roots. Why aren't people... I don't know why our offices aren't full. It makes me insane. Anyways, item 3. Lazy Americans. I'll admit from the get-go right here, I'm lazier than I want to be. I am. Don't tell anybody. And I weigh more than I want to weigh. Shh. Keep it on the DL, folks. For you older folks, DL means down low. Keep it on the down low. It means don't tell anybody. Shh. But no doubt, I'm 46. I get to work at 8 a.m. And besides, I do have a 2-hour lunch. But I leave at about 8 p.m. And working out doesn't typically get the attention it deserves. But I can tell you this. It's not because I'm sitting around idle playing video games. So I feel better when I make that thing clear. I feel better. Anyways, this is an article from the AP called, Associated Press, called Americans Getting More Inactive, Computers Partly to Blame. It was written April 23rd, 2019, so hot stuff.
Hot stuff coming up.
The highlights of the article are as follows. Number 1, Americans spend almost 1/3 of their waking hours sitting. I can see that. Yeah, I can see that. Number 2, sitting time increased over the last 10 years by about an hour per day, to the point teens are sitting for 8 hours a day and adults are sitting for 6.5 hours per day. An hour a day more of sitting just in the last 10 years. That, to me, was just kind of mind-boggling. Number 3, by 2016, 50% of kids and adults spent an hour or more of leisure time on computers. Oh, yeah, I can see that for sure. Number 4, TV use was generally unchanged. Number 5, U.S. activity guidelines released last fall say adults need at least 150 minutes to 300 minutes of moderate to vigorous activity each week. Things like brisk walking, jogging, biking, or tennis. Muscle strengthening 2 days weekly is also advised. So need to be lifting weights at least a couple days a week. Now, the last point of the article, kids aged 6 through 17 need 60 minutes of moderate to vigorous physical activity daily, and I promise you they're not getting it. Okay. I mean, they convinced me. It's time to force myself to get busy walking, biking, lifting some weights. I mean, I have everything already. It's just the time and the energy that I need to figure out, I swear. But I'm working on it. Y'all don't worry about it. Don't worry about it. Do you ever feel like your practice owns you rather than you owning your practice, though? I mean, if you're doing it right, well, I guess that's right. But if you're doing it, of course you feel that way, like your practice owns you rather than the other way around. I mean, but it's all about balance. And I feel like me personally, I have zero balance. I feel like it's all work right now. And, while that's a good problem to have, a good problem is still a problem. I mean, it is. April brought us a lot of blessings, the month of April. And it brought us like 80 new patients, which is a lot for me. I'm used to 50, 55 new patients, but 2019 has been a whole different animal, man. From December on, it hasn't been a roller coaster. It's been straight up, and I can't thank the Lord enough for the blessings, but managing to treat them at a high level when it's just me is most certainly quite the balancing act. Luckily, the DACO courses provided me with some quick ways of evaluating things that I didn't really have before, so I can move through new patients with efficiency. Spinal manipulation is a fairly quick and straightforward process, if you're being honest. It doesn't take 30 minutes to manipulate somebody. And I have staff to walk them through the exercise rehab portion. It's not so much the treating. I think the time suck is the communicating, the connecting part of the deal, the questions, the idle talk that is meaningless but is vital to relationships. That's what takes up so much of the day. For some coming to our office, it's the trip of the day, man, or the outing of the week, right? For them, it's an event, and they want to experience it. They want to be in the moment and chit chat and connect. And we better be on board for that with a smile and kindness and some love. Still, it's time for me to start moving in a direction that lightens my load a little bit. That may look like raising prices so it thins out a little bit, or it may look like hiring an associate. And I'm just not sure right now, but I'll know when I know. I don't rush anything. I'll know when I know. I don't do anything by accident. I do a lot of homework. I ask around. And through my involvement with my state association, my network of advisors is vast and really, really valuable. So I'll keep you up to date on any happenings as far as any of that goes. But for now, let's get to the message. The message is the same that it is every week. I want you to know with absolute certainty that when chiropractic is at its best, you can't beat the risk versus reward ratio because spinal pain is primarily a movement-related pain and typically responds better to movement-related treatment rather than chemical treatment like pills and shots. And when compared to the traditional medical model, research clinical experience show that many patients get good to excellent results through chiropractic for headaches, neck pain, back pain, joint pain, all that good stuff. Chiropractic care is safe and cost-effective. It can decrease instances of surgery and disability. Chiropractors normally do this through conservative, non-surgical means with minimal time requirements or hassle on the part of the patient. And if the patient develops a preventative mindset going forward from initial recovery, well, chiropractors can usually keep it that way while raising the general overall level of health of the patient. And doesn't that sound like a hell of a deal? But the key point, if you don't remember any of the rest of it, is that patients should have the guarantee of having the best treatment offering the least harm. Booyah. That is chiropractic, people. Send us an email at dr.williams@chiropractic4.com. Let us know what you think of the show. Tell us what your suggestions are for future episodes. We want to hear it. Feedback and constructive criticism is a blessing. So are subscribes and excellent reviews on iTunes and everywhere else. You know how it works in 2019. If you like something, you got to support it. I'd appreciate it. We can't wait to connect with you again next week. From the Chiropractic Forward podcast flight deck, this is Dr. Jeff Williams saying upward, onward, and forward. Be sure to find me on social media sites such as Facebook, Twitter, LinkedIn, and YouTube. While you're at it, give us a thumbs up on YouTube. That's super simple. Be sure and visit chiropractic4.com. Give our podcast a listen. Lots of wonderful, wonderful information there. And as always, thanks for listening. We'll see you next time.